hard to get through everything and give them a home program, so we're going to be saving that for the second visit. With that being said, we need to make sure that on the second visit we are doing the home program, which we'll go into more detail later. We also are going to be auditing the balance protocol and making sure that you're following those standards that we've already reviewed. So you want to make sure on the balance protocol that you're dating each date in the box, and I'm going to be checking to make sure that we're not spending too much time in one phase. The PT really has to keep a close eye on that. If we're on the 4th week of the balance progression and we're still in phase 1, then we're not progressing them at the right pace. So we need to make sure that we're following the rules, but we're also making sure we're not spending too much time in one phase. And so you have to really keep a close eye on that, because what's happening is we're getting to the last week and they're still on the beginning of phase 3, and we just completely skip gait, and we don't even get to do their fitness center transition, and then we're missing out on the big picture. So we need to make sure that we are progressing in them at the right pace. If for some reason somebody's taking longer, then we just need to be having that discussion with them and making sure that they're willing to continue at the end of the 6 weeks. So it's okay if we set a new plan of care to finish up the balance protocol, but some patients are ready to be done at the 6 weeks because that's what we've told them it's going to take, and we just need to really be communicating that with the patient. And we also need to make sure on the balance protocol that you're documenting which lower extremity is the dominant one. So remember, at the top of phase 1, if it's the leg that they kick with, that you're going to circle it and then put it at the top of phase 1. So you would put right dominant on the top of phase 1. Any thoughts on the balance protocol, Dr. Lott?
Nope, sounds good.
Okay. With the home exercise programs, what I'm going to be checking for is that we're in the right phase. And so what that means is when they start phase 1, they need to have a phase 1 template from MedBridge. And so making sure that they either have like warm-up exercises, so those would be the ones that include the heel to toe, long arc quads, marching, and that is all documented on MedBridge under the templates. And so you would just search balance phase 1 and you'll have your options there, and then just choose three exercises is plenty for the patient, 3 or 4, to make sure that you're not overwhelming them with too many. I've seen some that have 6 or 7, and we want to make sure we keep those at a reasonable number, but make sure that they're in the right phase. So when you're in phase 3, you need to have a phase 3 exercise program, and when you're in phase 4, you need to have either a phase 4 exercise program or be working on the fitness center transition. So I don't want to see people in phase 4 and still be working on long arc quads and marching.
And how are they saved in MedBridge?
So when you go to the templates, you would search balance, and you'll see balance phase 1, phase 2, phase 3. And so they also are split up into beginner or advanced, so you have those options to choose from. And you'll have to choose which exercises are appropriate for your patient. And so some of them, like a sideways lunge and the modified center of gravity, some people may not be able to do, but you have another option, so you have a variety of options to choose from there. We also want to make sure that we're initiating the fitness center transition early enough, and again, that we're providing that home exercise program on visit 2 now. So don't forget to include that, and we'll go over where that goes in your balance manual. Anything on home exercise programs?
No, I just think on the fitness center transition, just to make sure that we think of it in terms of we need to really press that as far as that is an expectation upon completion of the balance program. More in the sense of the fact that they have a direction, because they're looking for someone to tell them what they need to do and how do they continue. And if we continually sell the idea and of the importance and tell them of this is how you continue to gain the improvements you're going to make from your balance program, you're going, because we all know that if we don't have a place for them to continue to exercise in the community, then they're going to unfortunately fall back to where they were in their balance.
And then moving on to the flow sheet. So on the flow sheet, a few things that I've seen come up. we want a dynamic warm-up to be included. So we do not want the person doing the new step and then coming in and doing their balance work, because then they'll be exhausted and won't be able to completely focus on their balance. And so we're encouraging a dynamic warm-up before they start, whatever is appropriate for your patient, but that should just be exercises to help them slowly progress into the balance protocol. But what I've seen is that some people will have warm-up and it'll talk about the dynamic warm-up, and then they'll also still have their new step warm-up. And so it looks like they're doing 18 minutes of warming up, and we need to make sure we fix that documentation and clean it up. So the new step could be like cardiovascular exercise, or reword it some way to make sure that you're not including that as a warm-up as well. You also want to make sure that you have the supplemental exercises on there that are appropriate. And so we do have those special cases, like a person comes in and they are having back pain. So when we do their balance progression, we have to supplement with a sitting rest break and maybe do lumbar flexion to help them with their pain. But we need to make sure that they're appropriate supplemental exercises. So why are you doing what you're doing? And then we also have the templates that should be carried over. And so when you go into WebPT, you can pull up a template. So for each phase you're in, you'll pull up your phase 1 template when you're in phase 1, and that'll give you options of supplemental exercises. But the big thing is, when I'm with my patients, and most of my time is spent on the repetition of the balance protocol. So most of the time I don't even need those supplemental exercises, but they are just there if you have somebody that is advanced and say they just flew through in the entire phase 1 and you need some other things to supplement with. That'll just give you some ideas. But we want it to be standardized, not feeling like, okay, I'm going to do balance protocol and now I don't know what else to do, so I'm just going to do lateral stepping over hurdles. But they're still in phase 1, so should they really be stepping over hurdles at this point? That would be more of a phase 4 activity. And so you want to make sure those exercises are in the appropriate phase, and we've already come up with templates to help you with that. I'm also going to be checking for the documentation and making sure that that's accurate, and so that'll be part of the audits. And so that really wraps up the flow sheet on my end. You have anything? The other thing before we move into the balance manual is we do really want to utilize the tools that we have. We're expecting a high number of repetitions in the balance protocol, and either to see you using the solo step or the NeuroCalm during one of those options during your session. And so you can be creative in how you use one of those, but say both of the solo steps being used, then we would want you to at least have them on the NeuroCalm, because we're showing them the equipment that we have in order to help them really focus on their balance. And so otherwise people may think they could just do this at home without us. So we have this equipment that we've invested in, and it's really important that we show our patients how we're using it. And so on to the balance manual. So you'll each be able to see one of these when you're in the clinic. But this is our new balance manual. And so this manual is given to the patient on day 2. And so you can discuss that they'll get a manual on day 2, but you don't show it to them on day 1. You can just tell them, next visit you come in, we'll give you your manual, we'll give you a home exercise program, and we'll be going through how to set that up.